So I was asked today to talk a bit about how COVID-19 has impacted cord blood banking. And I will talk about the Cleveland Cord Blood Center experience. We are a public cord blood bank, an NCBI bank. We have our FDA license, and we're accredited by the AABB and FACT. So much as we do with lots of our other projects, we first established the main priorities, and that would set the stage for how we would address the COVID-19 new climate. So our main objectives were to keep our CCBC employees safe, continue to serve our constituents with the highest standards, and do our part to slow the spread of the coronavirus. So everything that we've done going forward about that was to balance those three priorities. I'm going to skip this slide because we all know what COVID-19 is by now. But so we took a three-tiered approach with an immediate plan, a responsive plan, and a long-term plan that was dictated by how we established them up front, but then we implemented them based on how the response and the quarantine was moving for COVID-19. So this is just a basic timeline about how quickly all of this happened. I think the first death in the U.S. for COVID-19 was on February 29th. By March 12th, public gatherings were banned in our state of Ohio and I think around the country. On March 14th, California started a shelter-in-place activity which affected one of our collection sites. By March 18th, we had initiated our start to our plans by requiring self-testing of employees before they reported to work. We banned any non-essential travel or non-essential visitors to our bank and implemented social distancing policies. By March 23rd, we enacted a minimal staffing model, which I'll talk some details about that. That allowed us to reduce the number of staff on site, but be able to continue to process units, ship units, and perform CTs on any cord blood bank units that needed to go out. So our immediate response was just to monitor health and identify risk exposure for our employees and maintain the efforts to contain the spread of the virus. We limited travel, limited collection site visits, and limited in-person meetings. However, we were able to continue our cord blood collections, processing, and our research and development activities, and we encouraged our employees to use telemedicine if they were feeling ill. The next tier of actions include all those immediate actions, plus we reinforced the high-risk identifiers to our staff, emphasized methods to contain the spread. We started plans for minimal essential staffing and what that might look like. And keep in mind, all this happened within a span of 2 weeks, so everything moved rather quickly for us. We determined that we would continue collections as we were allowed by our collection sites, which for us is we have 2 collection sites in Ohio, 2 in Atlanta, Georgia, and 1 in San Francisco, California, so we span across the nation. We identified technology needs for employees to be able to work from home and identified work that was appropriate for our staff to do out of the office and started to investigate the coronavirus relief packages that were available. So this minimum staffing model, we established that there would be 1 leadership point person on site, 1 administrative staff, 1 collection staff, 1 QRA staff, a processing facility leader, 2 processing facility technicians, 1 CTI lab technician, and 1 R&D lab staff on site. So typical staffing model for us looks like 26 people working a day, and we were getting down to 7 or 8 a day. There are a few people that can satisfy more than 1 point on here, so sometimes the actual number of staff on site varied. The rest of our staff were given technology and ability to work from home, and we have not furloughed or laid off any employees so far. Some of our long-term plans that we instituted was to enact this minimum staffing model, which we have been using for the last 5 weeks. to think about budget preparations if we would see a decrease in the number of units used for transplant, if our collection sites were closed, and we were able to apply for some small business loan relief and establish what our plan was for shelter-in-place restrictions, and if shipping either from the collection sites or our CDs and orders were impacted by airline schedules. So some of the strategies that we've been using going forward are monitoring of the CDC and FDA websites for new directives. We have weekly meetings now with Zoom with management from each department to review any new directives or challenges. We've designed and monitored an action plan to reduce the risk of exposure to our staff. We monitor the collection site directives and make any appropriate changes needed there. We review and implement our feasible responses to the directives, and we'll evaluate this impact after the pandemic is under control. So some of the impacts that we've seen, first on revenue, I compared our revenue for the first quarter of last year to the first quarter of 2020. We've seen a decrease in our HRSA funding, a decrease in the revenue from distribution for transplant, and just a minor decrease in the revenue that we get from distribution of research units. The other thing we looked at was what the impact was on collection, overall distribution by number, and by the units distributed for research. So you can see that we've seen a decrease in the number of units collected and transplanted, but the number of research units that we've actually used has gone up since the coronavirus restrictions were implemented. We took a look also at our collections, our actual versus projected. So we have 5 collection sites, and 4 of them are still running. Our 5th collection site was closed in the middle of March. And you can see from the graph that we are below what our projected collections were for every race group that is there. It seems actually a bit more for Caucasian than some of the other races, which I can't really explain. We also looked at to see if there was an impact on the units we were able to list, and they are lower than our projections with the exception of multi-race units. And a large decrease, especially in Hispanic and Caucasian non-Hispanic units that are listed from our projections. The other thing we looked at to see was if there was an impact on the days, the time from request to actual shipment. And you can see that we've had some units that were requested with a very short timeline since March. We had one that was a really long timeline, but other than that, most of all of the units we have sent from March and April were requested with less than a week's notice for shipment. It's not entirely uncharacteristic. Usually it's about half are greater than a week and half are less than that. But we have seen that there are more urgent orders since March that have come through our center. A couple of conclusions that cord blood is useful in this time of COVID-19. We've heard all day today about how the impact has had on donors. The cord blood can be shipped quickly because it's already been collected. Likely the cord blood that's used currently was collected prior to COVID-19. Collections can continue with appropriate social distancing, and cord blood banks can adjust staffing and logistics to operate safely. And our major challenge has been to maintain our safety of our employees while continuing to be able to serve our constituents. And our minimum staffing model, we feel, has been one way to mitigate that.